evening, everyone, and welcome to Meet the Joint Ankle, part of the National Hemophilia Foundation's Make Your Move Physical Therapy webinar series. This new series is supported by a cooperative agreement from the Center for Disease Control and Prevention. Our presenter this evening is Luke Smith. Luke T.L. Smith, PT, DPT, CEAS, CSCS, is a physical therapist at Thomas Jefferson University Hospital in Philadelphia, Pennsylvania. He has worked with Jefferson's Hemophilia Treatment Center, Cardiza Foundation for Hematologic Research for 7 years. Luke was a part of NHF's Physical Therapy Work Group and is currently the PT representative for the Mid-Atlantic Region 3rd's Regional Executive Committee. Welcome, Luke. Our program will conclude with a question and answer segment. There will also be an evaluation after the presentation for participants to complete. Your valuable input will help us better define programs for the future. To ask a question, please go to the area in the far lower left of your webinar screen and type your question in the field just to the left of the Send button, which is located in the pod or area labeled Chat. Click the Send button when you have finished typing your question. However, please note that your questions will be addressed during the Q&A session, which will follow the presentation. The PowerPoint presentation will be available as a handout. However, a recording of this webinar will be available shortly on the National Hemophilia Foundation website at www.hemophilia.org. For more information, be sure to visit www.stepsforliving.hemophilia.org. Without further ado, I will now turn things over to Luke.
Well, hello everybody, and thank you for taking the time to spend it with us going over the ankle. I'd like to thank the National Hemophilia Foundation for the opportunity to speak to you guys. Let's see here. Looks like I'm trying to advance the slide and I can't advance it.
Okay, Luke, I've given you control of the presentation. You should have a message on your screen. Just click OK and you'll be able to advance.
Where do I click? Oh, okay. Thank you very much. So the objectives for today, we'll cover some anatomy and the function of the ankle. Sometimes when you're thinking about the anatomy of the foot and the ankle, it gets to be a little cumbersome and could be a little overwhelming. So I'm hoping to just kind of highlight a few points that I think are pertinent that might allow you to have maybe a better discussion with your healthcare provider, whether that's your physical therapist or it's the hematologist at the center, the nurses, the nurse practitioners. So that you're more aware of different things. The other thing that I want to cover is just being able to recognize what happens with a bleed and the impact that it can have moving forward in terms of your function and in terms of how you're getting around. And finally, what can we do to address some of the issues that come up with an ankle bleed? And so I'm a physical therapist, and we love to exercise, right? And so we'll go over some different things that are very simplistic in nature and very easy to apply. So as you can see in the picture here, this is your foot, and these are the bony structures. And the highlight, and not necessarily going through all the different names of the bones, but really what I want to break down for you is that if you can think of your foot in almost like 3 regions, right? So you have kind of a rear foot region, and then if you can picture that there's a mid-foot area, and then what we would call like a forefoot, so like where your toes are. And so if you can think of your foot in that sense, I think it makes it very easy and very simplistic as you're having a discussion with, different providers. So the ankle, when you think of the ankle, we have a big shin bone, and really there's like two bones that really kind of make up your shin, but really the shin bone, there's like one big bone that we think of. And they meet at that rear foot, as I talked about in that first slide. If we were to go back, you can see this area here. It meets right there. And there's like two little bony structures at the ankle that are kind of landmarks. And it's really, something that sometimes becomes tender. And, if you had some type of an injury, sometimes doctors look for fractures in that region. But it's a nice little landmark to think about. So if you're curious and you really want to know the names of what we call these, the big bone, the big shin bone is the tibia, the smaller one is the fibula. But I think for our point in our discussion, just having an idea that, this is basically what makes up the ankle joint per se. There are multiple bones, as you can see, and they all interact, and they all have movement, and that's why the foot is so unique and special, and it's the first point of contact when you think of walking and moving, and if you were getting into running or jumping or squatting. There's a lot of things that need to happen, but really for the purposes of our discussion, this area is what we would call your ankle. And so when you think of the bony structures, there's also, I guess, ligamentous structures that kind of hold some of these bones together in a more stable manner. And if you look at this slide, it looks really intimidating. Just keep in mind that, your healthcare provider, whether it's the nurse, whether it's the doctor, physical therapist, we're keeping all these things in mind. But really, when we think of some of the major areas that, tend to get injured, it's usually the lateral components. And so I'm going to highlight just kind of this lateral area. And when we think of like spraining your ankle, this is basically the main region. And so there's a ligament called the anterior talofibular ligament. So I just want to point out some of the more common things. As you can see on the screen, there's a lot of different structures here to highlight. But really, this is one of the main structures that really gets injured if you were to twist your ankle or you fell. And this is on the outside of your foot, on the lateral side. If we went to more of the inside, or what we call the medial side, again, looks very complicated, looks very messy, if you want to think of it that way. But again, here, just kind of with the highlight, you can see that these are some of the structures that we would be concerned about, some of these medial ligaments that kind of give you some of that support. So if you feel around your bones, you have your shin bone, as I mentioned, and then there's two little prominent bones that come either on the inside or the outside of your ankle, right? Those are the endpoints of those bones. And then lower down are some of those ligaments that we talked about. So with ligaments, then there's also muscle structures. And if you can see in this slide here, there's so many different things that are involved, and the muscles then become, tendons as they attach to different bony structures. The two muscles that I really just want to point out in terms of just functional aspects is what we call the calf, right? And so the calf is made up of two different muscles. And I just want to point that out, that it's a big structure, and it ends up inserting right in this region here. Right? The other muscle that I want to point out is the muscle that's pretty much on the shin bone, and it's this muscle here. So if you think of, you have the big calf muscle in the back, And as somebody joking around told me, then we have the front calf muscle, but don't go and say that. But so those are the two main muscles that I would say are important to make note of. In this slide here, it's just showing you again more of the complexities of the ankle and why it's very important to kind of pay attention to things. This is again the outside part of your ankle, and there's different structures that kind of prevent things to move and slide and glide better. This is another picture just kind of showing some of the structures that built into the lower part of your ankle. So what does all this mean, right? We looked at all this anatomy. We have an idea of the bones. We have an idea of the muscles. We have an idea of some of the ligaments that keep the bones together and keep some structure. So what does the ankle do, and why do we worry about it or pay attention to it? Well, if you think of the lower foot and you think of the leg, the foot and ankle are basically the first point of contact, as I mentioned. And so the leg is really important in terms of accepting and also transmitting different forces. So when I'm walking or I'm stepping up, the foot and the ankle are the first things that make contact. And so what's very unique is that it has to be able to provide not only stability, and that comes from the bony structures, it comes from the ligaments that I mentioned, it comes from muscles activating, but you also have to provide mobility, right? So you have to have some stability, but you also have to have some mobility. And with doing those two things, you have to be able to accept different forces, but you also have to be able to transmit forces. And that's where if you have an issue or you get an injury or you twist your ankle or maybe you have a spontaneous bleed, how that could impact the joint and then impact the function overall, which we'll talk a little bit more about. So with walking, or the gait cycle as we talk about, we think of it as your heel hitting the ground, and then let's say my right heel hits the ground, I take a step onto my left, and now my right heel hits the ground again. That would be one complete gait cycle. And the reason I'm showing you this slide is to give you an idea that there's what we call time spent on the ground, and there's time spent in the air. And so there's a standing phase and there's a swing phase. And you can see we spend more time on the ground with walking than we do swinging our leg. And different muscles and different parts of our body have to activate in terms of the lower half of the body that are very important. So, when you think of the foot, you think of the ankle, as I mentioned, we have those muscles of the calf and we have the muscles in the front of the leg. But really, when you think of walking, it's more involved. There's muscles of the hip, there's muscles of your glutes, your hamstrings, your quads. All those things are important in the cycle. And how those things interact are very interesting. And so it's not just a smooth kind of pattern. Sometimes it becomes, as you can see, if you think of an upside down kind of pendulum where your hip is kind of going through this wave, so to speak, and then you have a swing of the legs. And so different age groups have different presentations in terms of how they walk, right? When you're a younger individual, the walking pattern is different than, say, somebody who's an adult. And so when you're about 2, 3 years old, about 3 years old, you start to kind of figure out something that starts to resemble more of a pattern. When you're younger than that, when you're in a 1-year-old, 2-year-old, there's a lot of different compensations that are happening. So the next thing I'm going to do is just show you a couple of videos here of just some people walking. And the first one's going to be of a 3-year-old walking. And the feet are pretty flat, and as you can see, she's almost getting into a little bit of a running pattern. So at 3, you're starting to develop a little bit of a gait pattern that's a little bit more resembling. And so by the time you're, a 7, when you're about 7 years old, you actually start to have more of a pattern that resembles something like an adult. And so the next video that I'm going to show you is just of a 7-year-old walking, and you'll see how it's different from that 3-year-old, right? There's a little bit more control. There's not all this movement. There's a strike of the ground. So there's definitely those type of differences that you can see. The next video is of an adult walker. And if you could compare the 7-year-old with the adult here, the pattern's a little bit more similar than versus the 3-year-old, where the pattern was a little fast, and where they were striking on the ground was different, right? So those walking patterns are people that don't have any issues in terms of any bleeds. But what happens when you do have a bleed, right? And if you can see in the picture here, this is a picture of somebody who had a twist of their ankle, and then it became more of an issue. So as I was pointing out earlier in the slides, knowing some of the anatomy can really help you, right? So if you know this is the shin bone, and if you know those little knobs at the end on the outside of your ankle and the inside, you can see how, that little twist that they took and the pulling of bruising here and some of the swelling. If you remember the slide from all the different structures in terms of, those ligamentous structures and then the muscles that we're kind of feeding into, you can see how some of those areas are probably of concern and some irritation. And so, having some of that awareness is really helpful in kind of pinpointing and treating and determining what you need to do. With the bleeds, there's a loss in the movement. Obviously, there's pain. There could be some bruising, some swelling. Now you're not moving the ankle, so now there's a loss of strength, and because of the pain, you're not maybe putting weight and using those muscles the way you need to, so now your gait pattern is a little different. The ability to perform some of the activities that you used to do, whether it's just going up and down the steps, whether it's standing at the sink and washing some dishes or cooking, becomes challenging. And if you can see in this picture here, the little bony structures that I mentioned earlier looks fine on the right, maybe looks okay on the left inside, but then the outside, very interesting, right? You can really see kind of that presentation, but there's just that swelling. And so very telling. There's not a lot of bruising. The foot seems to be okay. It looks just like the irritation is just at that region, right? So kind of knowing where, the anatomy really helps to kind of decipher what you need to do. So what do we do when we have a bleed? What's important? Well, one of the first things that you want to do is properly treat with factor, right? If you're thinking there's an injury and then and we're suspecting that this is a bleed, we want to have factor on board. We want to have the proper dosage and making sure that that's in the system. Then whether you're limiting how much pressure you're putting on that joint is important just for a healing perspective. So limiting your weight, whether you're using crutches, whether you're using some type of a cane, whether you're just staying off of it and resting, is very important. The compression component of it, just to kind of help normalize some of the tissue, is very important as well, and the elevation. Once things start to calm down, you really want to start getting it moving, right? So we have factor on board. We've been resting. We have, respected some time and haven't put too much weight on it. So now we want to get into some motion. So the first thing you want to think about is, how can I move within a relatively pain-free situation? And, doing some range of motions is kind of a way of doing it, and then progressing to doing some form of a stretch. And when you think of stretching to gain some motion, you want to hold for about maybe 30 seconds or so. Sometimes you can't build up. You have to build up to that 30 seconds, because 30 seconds can be a little while. So you can start with 5, maybe 10, and then slowly work your way up to 30. And, the stretch should feel kind of like a light pulling type of sensation. So as you can see in the picture here, we have something called the alphabet, right? So you picture your big toe or your great toe as the point of a pen or a pencil, and you're basically spelling out the ABCs, right? So if I was, moving my ankle, then I'm, spelling out, I'm not the best artist, but you're spelling out an A, you're spelling out a B, just moving through, getting some good motion within a pain-free range, right? You're not trying to stress anything too much, just real light. You could be sitting down, or you could, be kind of in this standing position as this person is. Another way of getting some range of is to do it kind of passively, where you're supporting the ankle and you're just taking your other hand and moving it through a range of motion, whether it's up and down, whether it's side to side, whether it's little circles. You can move other areas of the foot, right? So you could also focus on maybe just moving the toes, moving some of that mid area that we talked about, or just really just moving the ankle region up and down. Other types of ways to get to stretching. So we talked about, moving the ankle, doing some range of motion and some movements. And now here we are trying to progress into more of a stretch. And here you can see in the picture that we're going through some stretches for the back part of the leg, so that calf area, the gastroc and the soleus, as I mentioned. So you're taking the strap and you're pulling it up towards you to create a pulling sensation in the back, right? And so you can use a strap, you can use a towel, something that's comfortable, just to kind of work on getting some motion. And again, you would, hold that for about, if you could work your way up to like 30 seconds, doing that about 3 or 4 times, as long as it's not, painful, that would be a nice progression. So as things start to calm down, you obviously, dosing with factor before you're moving. Things are, now you're able to put more weight on it. The swelling's gone down. You're doing the range of motion exercises, and it's starting to feel a little bit better. Well, we can start thinking about getting into some strengthening. And, what kind of exercises can we do at the ankle? Well, let's talk about, what should our kind of system be. So again, you want to think about pain-free activities. You don't want to do, a lot of exercises and all of a sudden it hurts. Now, every time when I say something like that, some people tend to say, well, I already have pain all the time. Well, so the answer is, listening to the body and not making it more painful. So if we wanted to grade it by numbers, let's say your pain level is, maybe a 3. Let's not make that go up into a 5 or a 7 out of 10, right? Let's stay within the 3 range as you're doing your exercises. So, when I say pain-free, I guess that's more not really adding to the situation. You want to think about lighter resistance. It's not about putting such a high load. It's more about doing higher repetitions. And so, working your way up to doing, 12 to 15 repetitions. You don't have to do 3 sets to start. You could start with just doing 12 to 15 reps one time, see how that goes. If that feels okay, and then you work your way up to 2 sets of 12 to 15, and then working your way up to 3 sets of 12 to 15. So in terms of exercises, you can see when you're thinking about the ankle, you need to think about the whole leg. It's not just important to strengthen, the front part of your shin bone and your calf. You really want to think about some of the muscles that live in the toes that provide some of the stability as well. So as you can see in this picture here, there's an activity of picking up, and this is, a 7-year-old picking up, I guess a popular thing these days is Shopkins. So picking up some Shopkins from the ground. So you can make it fun, you can make it creative, you can use, marbles, you can use different pebbles, something that you can hold. You could scrunch up a towel if you aren't so inclined of picking things up. You can, scrunch a towel together and hold that position for a few seconds. So there's multiple ways of kind of getting at the activity to make it, fun for various age groups. But very important to kind of strengthen some of these muscles in here. The slide in the middle, or the picture in the middle, we're working on some of the muscles of the upper part of the leg. And as I mentioned with the walking, the forces start at the foot and translate all the way up. So it's important to have mobility and strength in this region, but it's really important to have all that in these regions too. So if you have some weakness in your quad or your thigh, as we call it, also, you want to address some of those things. So here, the person is just basically laying down and just raising up their leg to a point where they hold it for maybe a second or two and bringing it back down and working on doing, 12 to 15 repetitions. So again, higher repetitions, but not a whole lot of resistance, right? We're just using basically the weight of the leg. You could make it challenging by adding some resistance, but for right now, you want to think of just getting through more repetitions than anything. And as you see, as things kind of progress and you can do a little bit more, the pictures here, you're dealing with more of maybe a higher demand where you're coming off of your heels and really working on some of those muscles, and now you're taking your whole body weight. So that could be a little bit more of a challenging exercise. You can start to do some of that maybe in a seated position to make it a little easier, and then work your way up to doing that exercise in a standing position. And it's a nice exercise to kind of work on some of those muscles that we just talked about. Getting into squatting positions, which, not only will work on the range of movement at the ankle and making sure things are going, but you're also working on some of these other positions here. So not everybody can squat, as you can see in this picture here, and that's okay. You can work on just going from a chair and sitting and standing, and that activity will kind of work on some of those muscles. You could, get yourself against a wall and just kind of hold that position in this bent position as much as you can to kind of, work on some of the muscles up top. If that's not really a possibility, if you're more comfortable kind of laying on your side, again, you can work on some of those upper leg muscles that are important for walking and moving and stepping and strengthening. So this person would be lifting their leg up and down in that fashion. Now, if laying down is not really an option in terms of doing some of those exercises, you can do some things seated with maybe a band around your legs. So we had a band here around the legs, and you're sitting down, and then you're opening and closing your legs. That would be another way of kind of working on some of the muscles that live in this area here, live in this region here. I think that some of the things that are really important is trying to make the exercises as fun as possible that you can for yourself. And the activities, when you think of exercises or you think of strengthening, sometimes just day-to-day things that you're doing, especially if you have a child, the different playing actually becomes a strengthening exercise and an activity and a range of motion. So sometimes it's just a matter of being creative in that sense and kind of working through a scenario. Well, I'd like to thank you all for listening, and if you have any questions, please post them through the proper channel on the chat, and if you don't mind also filling out the survey so that we can come up with topics or just give us feedback in terms of what we can best provide for you all in terms of education.
Thank you, Luke. Ladies and gentlemen, to ask a question via the web presentation, please select the chat pod located in the lower left corner of your screen, then type and send your question. If you would like to ask a question via your phone, please press *1 on your telephone keypad. I will announce each caller prior to bringing you into the conference. Please remember, if you have your phone on mute, take it off mute when you are selected to ask your question. Once again, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. To ask a question live, please press *1 on your telephone keypad. We'll pause just a moment to accumulate questions. Okay, perfect. We have no questions at this time. Ladies and gentlemen, your feedback is critical to us, not only in evaluating this presentation, but also in planning of future webinars and programming. Please complete this 5-minute survey appearing on your screen now by clicking on the link. For each webinar in this series that you attend, completing an evaluation will enter you in a chance to win a Fitbit at the end of the series. Attend and evaluate more than one webinar to increase your chances of winning. Thank you again for attending, and this concludes the program.